Healthcare in China, it's expected to grow into a $1 trillion industry by the end of this decade. The research from McKinsey and Company says virtually every health sector will benefit. And that's not just for traditional Chinese medicine, but also pharmaceuticals and medical devices. McKinsey says foreign companies are looking to invest more in China, shifting away from places like the United States, Japan, and Western Europe. India, on the other hand, is moving to reduce its health spending by at least 10%. Proponents of the reduction say local governments need to take more of the burden. Critics say India's poor population could be the hardest hit. CCTV's Shweta Bajaj has insight from New Delhi.
In this clinic in South Delhi, Dr. Tara treats patients free of cost. In the last 10 years, she says health situation has only worsened. Dr. Tara, who has been working tirelessly in India, says it's India's primary health infrastructure that lies in shambles, and a budget cut means more bad news for India's poor.
This is not good because we are not focusing more on our health issues. Since in our country communicable diseases and other infectious diseases are too much, government is not taking too much care on the health because we are thinking that there are too much super specialties hospitals are there, but we have to focus on the primary hospitals.
Dr. Tara works for Uday Foundation, founded by Rahul Verma in 2007 after his son was born with multiple congenital defects. Uday Foundation works to ensure health for underprivileged children and adults. But Rahul says budget cuts are demoralizing, and the Indian government needs to also look at massive health projects that it started but never finished.
They have to monitor the same thing the way we are focusing on the other area, on the urbanization, on the this IT industry, and the same thing. The health has to be taken care in that SS condition.
India's healthcare industry is robust and is dominated by private players, and they have been seeing on an average a growth of 15% annually. But somehow, public spending on healthcare has remained low. And that's the reason that government hospitals like these have bad infrastructure and are overcrowded. The situation in rural India is even worse. The World Health Organization recommends spending 5% of a country's GDP on health, 5 times more than India's annual health budget. Cut in India's health budget means more communicable diseases and delay in an ambitious plan to provide healthcare to all Indians free of cost. India's funding to its AIDS program has also been cut by 30%. But India's ruling party BJP's explanation is that the state government should now spend more money as they now get a larger part of tax revenues.
The amount that was collected from divisive pool, about 42% of that goes to the states now. Previously it was only 32%. This increment of 10% definitely has left the central government with less amount of money in hand to expend. And now the states, as far as the medical sector is concerned, as far as the other sectors are concerned, now the state and the centre are almost equitable partners in performance.
On the World Health Day on the 7th of April, Indian Prime Minister said his government is working tirelessly to realize the dream of a healthy India. Shweta Bajaj, CCTV, New Delhi.